coronary artery bypass operation successfully last night. The operation was performed by a team of doctors, nurses and technicians of Sky Hospital Imphal and AMRI Hospital Mukundapur, Kolkata on Mrs. Nungsi Devi, 55 years old, from Thobal district, admitted at Sky following a heart attack. The team from AMRI was led by Dr. Arijit Datta, Senior Consultant Cardiac Surgeon and HOD AMRI. The operation started at around 7 p.m. last night and finished at around 1:30 a.m. this morning. It was performed in a beating heart which increased the chance of survival. The patient is recovering well and has started drinking water. Her own heart is beating, her own lungs are breathing in, and she's drinking, she's taking food, and she's responding to what you talk and she's talking. That is the happy moment. This patient would not have survived without this bypass operation because almost all the major arteries supplying the heart were blocked. This artery called left coronary artery. It was blocked at the origin except a small branch which was also 99% blocked at the origin. With this condition called subtotal blockage of left main artery, the heart, and having had a heart attack, this patient was not fit to fly anywhere for such operation. The patient survived because she had the opportunity to have the operation on site in Manipur. Such patients do not survive if not operated promptly on site as soon as possible or flown by air ambulance elsewhere as soon as possible, because this patient requires continuous monitoring and care during transport by air. So this patient and such patient requiring bypass surgery or any form of open heart surgery need not go outside the state of Manipur, as such facilities are available in Sky Hospital, which provides a very high standard of heart care. Thank you. About 7 days, 5 to 7 days. Now I will pass on to my colleague and our visiting senior cardiac surgeon from AMRI Hospital Mukundapur, Kolkata. Dr. Datta, please. Thank you, sir.
We are proud to be associated with this hospital, Sky Hospital, under the able leadership of Dr. Shyam Kishore. And it was a privilege to get to operate on this patient last night. Like Sir just said, she was not in a state where she could have been shifted outside the state at all. She had subtotal occlusion of the left main with a recent heart attack in February, and she was just recovering. So when Sir asked us to come and operate, initially we were a little hesitant. We thought maybe let us see, let us have a look. Then she turned out she has been very well managed after a heart attack over here. She has recovered. So it was the perfect time to operate on her. So we started last night. It took some time because it was the first operation here. And thankfully, like Sir said, with God's grace, she is doing well now. She can be shifted to the ward, and another 5 days she can be discharged, hopefully.
Okay, I have a question. Is there any chance for relapse of this the bypass artery? Is there any chance of having the same blockage?
See, the disease which happened in the heart, the coronary artery disease, has also affected all of the arteries of the body. What we do is just make bypass grafts. We bypass the block. but we have not done anything to the disease process. That we are doing now. So post-op care means all medicines and statins and anti-cholesterol or cholesterol lowering drug, these have to go on. She has to she is not a diabetic, but for people who are diabetics or who smoke and all, the post-op period is as important as the operation. What we say is that 50% is done by the doctors, 50% the patient has to do on her own. So that is how we sort of control the disease, but we cannot cure the disease completely. No one can.
So that's a very relevant, very good question. Because if the patient doesn't take care, for example, the risk of having heart attack and having this coronary artery disease, the atherosclerosis, blocking of the artery supplying the heart, and also brain and other part of the body. The risk factors are like diabetes, high blood pressure, smoking habit, high cholesterol, sedentary life habit, sedentary lifestyle, okay, lack of exercise, and then unhealthy eating, like for example, junk food, and then a lot of oils, and then eating red meat all the time. So these things, if the patient continues, then the chance of recurring, as you said, the chance of recurring this problem is very high. If she or he behaves and then eat healthy eating, eat healthy food, and then regular exercise, and try to control if he has got diabetes or high blood pressure, try to control that, and if your cholesterol is high, try to control that with medicine and with change of food habit. So all these things will definitely help reduce the risk of the problem coming back.
Kan 자기 그 비주얼